So thank you all for joining us. Today we are going to be discussing or have a presentation on communicating effectively to manage staff buy-in. We've heard repeatedly that there has been some challenges in some facilities with getting staff to adhere to new practices and protocols. We all know that change is very hard, so we're very grateful to have Lynne Hall from the Georgia Hospitals Association talking to us about this today. So Lynne works for GHA, as I just mentioned. She's an advocate for patient safety and quality. She also represents GHA as a maternal child health expert with the Georgia Department of Community Health. Lynne has over 30 years in the healthcare field and began her career as an L&D and neonatal nurse for 18 years when she became passionate about quality improvement. Working directly with the DPH Commissioner, Dr. Fitzgerald of the Department of Public Health, Lynne was instrumental in reducing early elective deliveries in Georgia, improving the rate from 32% down to 2%, utilizing Lean Six Sigma Black Belt certification skills. Lynne has been a member of the leadership team for GaPQC since 2012. She also serves on the Maternal Neonatal Council as an appointed member, working on levels of care designation for hospitals. Lynne became a Master Team Steps trainer in 2012. Teaching and sharing her knowledge is another of her passions. Lynne received her BSN from Emory University and graduated cum laude. She has 2 large dogs and a cat. So thank you, Lynne, for being with us today.
I love my 2 large dogs and my cat. But I really hate that he has over 30 years experience. I remember being a new nurse and having a patient ask me, well, how long have you been a nurse? And I couldn't wait to say I've been a nurse for a year. And now it's been 30. Wow. So today I want to talk to you about communicating effectively. And the reason why we pick communication is because that's one of the key components to make sure that staff is going to buy into any kind of change that you implement in your hospital, especially now that we have this new initiative that is more structured than what we have previously done in the past for maternal hemorrhage. So next. So I want to ask you guys, this is just a little agenda, what is buy-in, how do we foster it, how can we improve it, and why is it often rejected? Next. So I want to ask you guys, what is buy-in in your opinion? And please just shout out any answers on the phone. I'll give you a minute or two to think, well, not really a minute or two, but I'll give you some time to think about it. What do you think buy-in is?
Agreeing to the plan?
Agreeing to a plan. Yep, that could be it. What else?
Support.
Support, absolutely. Anything else? Okay, next slide. What we're going to talk about is what is buy-in. Well, buy-in is committing to the mission or goal of your hospital, and they have found in numerous studies that people that are aware of what's going on in the hospital and why they're doing a change are more likely to go that extra mile and feel personally rich and joyful. And I don't know if any of y'all are familiar with it, but joy in the workplace is a up-and-coming and very real thing to have, because joyful employees that want to come to work, that find it interesting, that make you want to go the extra mile, that's really important. So it engages the employees. And you'll notice that employee satisfactions will go up, and you'll probably have a lower turnover rate. And we all know that turnover is an issue. So we want to get those people on board and have them really commit to that buy-in. Next. Okay, so now we know what buy-in is, but how do we do this? How do we make sure that we've got our staff's attention and that they're going to want to do what we ask of them. So how do we do that?
You can hear.
Next. Well, one of the things that you want to do is make sure that you have an accessible leader. Okay, it's really important to make sure that your leadership is accessible when people have questions. A lot of times in the past, people have come down with edicts and say, okay, we are going to implement this hemorrhage bundle, and this is the bundle that we're going to implement, and this is what's in it, and end of story, here, go. And then you've got people that are kind of like, well, why do we have to do this? You know, what was wrong with the way we were doing it before? And they get really kind of non-compliant with it. One example is that we had a new way to stock our delivery rooms. And I admit it, I have been both a cheerleader and a naysayer. And when I was the naysayer, I was like, well, this is dumb. I can memorize this list and stock the room without any problem. And I didn't use the list a lot of times, and there were little things that I would miss. Instead of 5 gloves, maybe there were 4 gloves. So it became important to me to understand the why behind what I was doing, and that's really important. Having people know from their leader a personal explanation. You know, I went to DPH and I heard about this new maternal child bundle, this new maternal child initiative, and I think our hospital would be really good at doing it. And that was my passion of why I brought it back to our hospital. Training is another thing. I cannot stress that enough. People are way more comfortable in any kind of change initiative when they have good, appropriate training. When you just hand them something and say, do it, they're like, how, why, when? So make sure that you have a good training program in place. Communication is really, really important, and we're going to go into a little bit more in depth in that in a minute. And then make sure that you have the broad participation. Make sure it's not just leadership that knows what's going on and you're just dictating to the frontline staff. Make sure that you're involving the frontline staff. Next slide. So one of the things when I talk about communication, you need to really make sure that people understand the core message of what you're trying to get across. Tell the frontline staff how and why the initiative is important. I mean, they may not buy into it, but from my experience, most labor and delivery nurses and neonatal nurses are awesome at this. But what you can go to them and say, Georgia has the worst mortality rate in the country. We need to make maternal hemorrhage a priority in our hospital. What can we do to make that the highest priority? What happened? So explain how that decision fits into your mission and visions and your values of your department or your hospital in general. If you have vision and mission in your department, bring it back to that. We're doing this because our goal is to help the patients. Show how it impacts the organization and the frontline staff. If we do this, we're going to save X amount of lives. If we don't do this, we're going to, we risk these people's lives and it costs us more money. Excuse me. If you have somebody that's in ICU because of a hemorrhage, that stay now goes from a regular normal vaginal delivery to a week-long stay in the ICU, which is very expensive. So bring those aspects into it. Next slide. So to me, communication is the most important thing, and you can't just talk to them. Okay, a communication is a dialogue between two or more people. So it's very important to take the time to tell them and explain to them the why behind what you're doing. If you have the why behind it, most people, the majority of people are going to follow you. If you don't have a why behind it, like this is just another one of those initiatives that they're telling us to do, then people aren't going to take it as seriously. If you mean it and you want to make Georgia a better place for mamas to have babies, then that's what's going to show your passion about it. And you're going to get the naysayers, and you're going to get those people that are like, I don't want to do this, or here we go again, or it won't work this time, we tried it last time. And you want to invite those people in, and you want to invite them in and ask them why. Why won't it work? Why is it here we go again? Informed employees, they are more likely to support your cause. They're more likely to get in your corner, and they're more likely to become the cheerleaders. And I've even had the naysayers become my biggest cheerleaders because I addressed their concerns, because I went with them on that road, that journey of why do you feel like this isn't going to work again? But you can't ask those questions and not have that feedback taken seriously. Next slide. So you're probably wondering why I have apples, because everybody says apples to oranges. You know, it's like comparing apples to oranges, which means they don't fit. But you also run that same kind of line as when you're communicating with your staff, you may think that they're understanding your apple, but chances are they may be thinking of an entirely different apple. Some apples are good for baking. Some apples are good for just crunching and munching. Some apples, you know, have sweetness. Some are sour. Some are tart. I mean, there's a lot of different apples. So when you're communicating, make sure everybody is thinking about the same apple that you are. We are doing this because. We want to do this because. How are we going to do it? You guys tell me. Next slide. We have a little bit of a delay sometimes. So fostering buy-in, how do we get people to understand that what we're wanting them to do is important to them? You want to give them information, but you can't give them too much information. If you give them too much information, they're going to start tuning you out. So you have to walk a fine line and make sure that you're giving them enough information for them to make an accurate I forgot the word I was looking for, but you want to give them enough information so that they can make an informed decision. You don't want to inundate them with data out the wazoo. You don't want to have a bunch of charts and graphs, but maybe a little one. You know, maybe let's have the Georgia maternal mortality rate on there or the neonatal mortality rate on there. You want to make sure that they see that Georgia is 50 and not close to being number one. So you want to give them enough information. So quantity is important. Quality is just as important. You don't want to be bamboozled or schmoozed, or, you know, when you're an employee, you don't want to have that leader come in and say, yeah, this is a great idea, and we're going to do it, and y'all are going to be behind it, and it's going to be wonderful. I call that the used car salesman quality. And you want to be genuine. You want to say, you know what? I don't want my niece who is pregnant to die in childbirth. I want her to be a mother and to be successful at being a mother. So I'm very passionate about making sure that we reduce maternal mortality. Give them your passion. Give them your feelings so that you know, so that they know that you are behind it as well. Next slide. So you also want it to be relevant and have a relationship to what they're doing in their job. How will it affect them personally? We all know that change, I have worked with several people who are, you know, that obsessive compulsive type A personality that just wants everything to be a certain way. And when you change and add a new system in or a new product in, they kind of get a little antsy and they get a little freaked out about it. What you want to do is think about, okay, now I've got this kind of staff, and I know that Sally over here is not going to do well with this change. So maybe bring Sally into your office and explain it to her personally and say, how can you help me get everybody to get on board with this project. So understand that any new initiative will affect people personally in some form or fashion. And when you do communicate, again, you want to just be clear, brief, and logical. Start from the top and go down to the bottom. This is a big Georgia initiative. What are we going to do at our hospital, and what are we going to do on our unit? Next. Understand how your senior team made the decision. A lot of staff, frontline staff, don't know hierarchy in the sense that anytime a hospital wants to join an initiative, they've got to go to the CEO who takes it to the board, and they decide a lot of times, is this the right initiative for our hospital? So understanding that this wasn't just this willy-nilly come from the sky plan of yours, you have to know that senior leadership is backing you, and if they ask you for feedback, if you ask for feedback, if you say, so what do you guys think? You want to truly consider that feedback. You don't want to just kind of blow it off and go, oh, that's a good idea, and then not address it. You want to say, okay, that's a good idea. We'll try it tomorrow. If it doesn't work, we can try it something else. So really take into consideration any feedback you ask for with all seriousness. And the most important thing I can think of is to include frontline staff in any decision-making processes. Are we going to do our statistics at the end of each day? Are we going to do them at the end of each week? How do you guys feel would be the best way to accomplish that? The more you can get from your frontline staff, the better the initiative is going to end up. The more compliant you're going to be in collecting that data. Because we can't see where we are and where we're going if we don't have good data. So turning in data on time is very important in making everybody understand what's going on in Georgia. So if you have engaged employees, they will work harder and smarter, and a lot of times they'll go, you know what, we used the maternal hemorrhage kit today, but we noticed that it didn't contain blah, so can we add that? And they're going to start giving you more suggestions, and they're going to start making it better for you. When you don't do that, when you don't give them that opportunity to give feedback and keep them engaged in the initiative, you're going to find that you're not going to get, we used the kit, yeah, it was fine, and you're not going to get the information that you want to. So make sure that you can explain it simply, and if you don't understand it, make sure that you get somebody to explain it to you so you can explain it to your staff. Next. So frontline staff, I cannot stress that enough. When we had, when I worked at a hospital, they were building an ER, a new ER, and when they did, they went to the staff first, and they said, hey, what do you guys need in an emergency department? What are you lacking now? What could we do to make it better? And they ended up with an ER that was fabulous because they took into account the frontline staff's needs and wants and desires. If it wasn't appropriate, then they would say, this won't work because of construction issues, permits, whatever. Now, when we're going down this maternal child AIM project and we look at maternal hemorrhage, we know what maternal hemorrhage is, and we know that it's important to get the bleeding to stop. So when we start a new project, engaging that frontline staff, they know what will work and what won't work and why it won't work. Then you can take that back to leadership and say, I went to my staff and they said this isn't going to work because of this, this, and this, but they suggested that we do this, this, and this. So you'll get more of a dynamic flow to your team. And I found this interesting that greater than 90% of nursing units were successful at conducting tests of change when their staff was involved. We had, do y'all remember when core measures started? Some of you probably do and don't. But they started and everybody was to get a flu shot because, believe it or not, that didn't used to be the practice when you went into the hospitals to make sure someone had their flu shot. So we had to hardwire it into our system. Well, we went to a unit and we got them to be responsible for the data, to collect the data. We had one nurse that was responsible for collecting all the shift data, one nurse that put all the data together. We helped them, of course, and it was amazing at the compliance ratio they had with getting that done because they felt like they had an investment in it. So staff buy-in is very, very important. And I was talking about this, don't just tell them what to do. You want to ask them. So we don't just say to them, we're going to do maternal hemorrhage drills in our hospital, and we're going to do them the third Thursday of every month, and you guys need to be there, and I'll have it 2 times during the day. Done. What if that's really not the way that your staff is going to learn the best? So the better question would be to say, what do you think we should do at our hospital to bring down hemorrhage rates? What can we do to help that? Did someone have a question? Okay, next slide. So why is buy-in rejected? We've all been there. We all know that we've had an initiative that we've been, okay, I got to get this going, I got to get this started, and then you get roadblocked. People don't understand the why or the how. Why are they doing this? How are they going to do it? And it wasn't communicated effectively to them. They don't know how or what to do. I think the next one is very important, is they don't think it's important. They don't see the results as being important. They don't agree that the end result is desirable. Maybe you have a labor and delivery nurse that's like, she's just bleeding a little bit, we're not going to worry about it. So you want to make sure that they understand that and they see that. And a lot of times people ask, what's in it for me? If I do this change, what's good? What good is it for me? Well, there's a lot of benefits, and you can think of some of the benefits. You can have other staff members say, hey, I see it as a benefit to me because of this, this, and this. So it really requires a lot of things done, but if it's done correctly, you only have to do it once. And if you get that buy-in, you will get that joy. You will get the people excited about the initiative and not dreading another initiative. Next. So we've tried that before. How many people, you always get it, I'm not going to do it, we've tried it before, it didn't work, and there's no reason to try it again. So you ask them, why didn't it work in your opinion? In your opinion. What happened? What did you do, and why didn't it work? Well, it didn't work because we couldn't get in touch with the doctors. Okay, well, we've got better communication things now. So what would happen if we tried it again and maybe see if it works? And I'm going to put you in charge of it. So then all of a sudden it becomes on them, and they're willing to take accountability for it. A lot of times you hear, here we go again, another initiative, another thing down the drain. You know, we went through this a lot with the early elective delivery initiative. You know, people were like, I'm not going to be able to tell a doctor he can't induce somebody. And we gave the power to the frontline staff, to the schedulers, and we said, you have the power to turn them down if they're not meeting the criteria. And people were like, well, what if they go to another hospital? I can't think of one physician that left a hospital because of this, because of the early elective delivery initiative. So I think it could happen, but it probably won't. So always make sure that you let them know that this is what happened last time and this is how we can fix it. It can also be caused by initiative burnout. We were talking about that today in our staff meeting. Initiative burnout is real. We all have them. People are asking us for our HIN project, how much longer do we have to turn in data? Well, do you have it right? Are you 100% accurate in your measures? Have you not had a maternal hemorrhage in, a year, 2 years, 3 years? If your answer